Good evening, everyone. Welcome to the webinar, Combating Cancer for Patients and Survivors in COVID Times. As the COVID-19 pandemic evolves, we are constantly learning more about this virus and how it affects us. This recent outbreak of the new coronavirus and the impact it has had on the world has been very worrying. And if you are or have been a cancer patient, or if you are a caregiver to a cancer patient, your worries and fears are probably multifold. However, the coronavirus infections may be avoided if sufficient precautionary measures are taken. The fact that the patients with cancer are much more vulnerable to COVID-19 infection and its complications has resulted in new challenges in delivering cancer care to patients. The most common questions that you would be asking right now is, if I am a cancer patient, am I more susceptible to COVID-19? If so, how do I go about with my cancer treatment? Is it safe for me to be visiting the hospital right now? Should I get myself vaccinated? And these are some of the questions that we'll be addressing during this webinar. Also, I would like to tell you that we will have live Q&A sessions amidst the sections of the webinar. You can please drop any questions that you have in the Q&A or chat box below, and we'll address them during the webinar. Welcome to the webinar again, and thank you for taking your time out to join us today. I am Meghna Muskan. I am a certified genetic counselor and practicing as a lead genetic counselor specializing in cancer genetics at Forbase Care. And I would take the pleasure of introducing our speaker today, who is going to take us through the do's and don'ts of cancer treatment and the whens and whys of vaccination amidst this COVID era. Dr. Rangaraju is a highly reputed and esteemed oncologist in India with over 30 years of experience in cancer treatment. He has played a significant role in improvising cancer treatment in India. Currently, he practices as a medical oncologist at Paras Cancer Center in Delhi. Dr. Rangaraju is a bone cancer and tumor specialist, and he also specializes in lymphoma cancer. His expertise lies in chemotherapy, hormonal therapy, and targeted therapy, along with supportive and palliative care. After completion of his MBBS and internship, Dr. Rao started his professional career in the year 1977, when he was commissioned as a permanent officer in the army, where he was also named as colonel. After his post-graduation in 1984 and serving as an internal medicine specialist for 7 years, Dr. Rao then completed his DM in medical oncology in 1993. He has served the Indian Army Medical Corps in various capacities for over 28 years. After that, he served with several major cancer institutes and hospitals in the country. He has organized several national and international conferences in oncology. He is a member of many national and international oncology societies, including the ASCO and ESMO. He was the scientific chairman of the first Indian Cancer Congress in 2013. He is also the founder and president of the Oncology Forum in Delhi. The list of his accolades go on and on. So I will just go right ahead and welcome Dr. Rangaraju. And I'm honored that he is here with us today conducting this session for us. So I would like you to please take the session forward.
Yeah, thank you very much, Meghna, for the kind introduction. And then thank you, Forbase Care, for inviting me today for this important topic. And though you're all doing the genetic test, and thank you for accommodating such a request to have the topic on cancer and the COVID, which is very important for the patients. And what I have seen over the period of last few months and even last year, that the cancer care has suffered a lot and the patients have suffered a lot. There have been a lot of dilemmas. I don't want to go into the numbers, which will be puzzling and then mind-boggling. I don't want to do that. But I think let's go over the actual basics as to what is to be done by us and you all. So let me share my slides, and then when we have divided this into some sections, and I have requesting Meghna to have question answer sessions at the end of each section. and then she will moderate the questions, and we'll have, and without wasting much time, then we'll proceed on to the next thing. So let me start with this program. And first of all, thank you very much for joining us here, and welcome to today's webinar. And then today, the very warm welcome from each and everyone. A lot of greetings from the Paras Hospital in Gurugram. Um, we have multiple other centers in the North India, and Paras Cancer Care offers the best possible evidence-based, personalized, comprehensive cancer care to all our patients. So today we are going to talk on combating cancer and COVID. I have made the slides in Hindi and English so that some of you who may not like to listen it in English, they would like to listen in Hindi. So both ways it's fine. So you'll find me talking about bilingual, and then we can talk in all both the languages. सो जब भी कैंसर होता है और कोविड होता है, सब हमेशा हम लोग एक ही परेशान में होते हैं, कैंसर के बारे में सोचें कि कोविड के बारे में सोचें. दैट्स अ बिगेस्ट परेशानी दैट वी हैव टुडे. बोथ स्टार्ट विद सी एंड देन हाउ टू कम्बैट विद बोथ ऑफ देम. सो द इम्पॉर्टेंट मैसेज ये है कि दोनों से ही जीतना है, कैंसर से भी जीतना है और कोविड से भी जीतना है. उसके लिए हम करें तो क्या करें. और मैं ये बता दूं, ये जो बता रहा हूँ, ये इट्स नॉट ए थियोरी, इट्स एक्चुअली हैपेंड इन टू मेनी पेशेंट्स. एंड लेट मी टेल यू, लास्ट ईयर वी हैड वेरी फ्यू पेशेंट्स हु हैड कोविड. बट इस साल में जब से ये बहुत महामारी पैंडेमिक तो महारूप ले लिया है, तब से बहुत सारे पेशेंट, आजकल कम से कम हमारे पेशेंट के लिस्ट में से 60% हैव कॉन्ट्रैक्टेड कोविड एंड हैव बिकम ऑल राइट. आई थिंक दैट्स द मोस्ट इम्पॉर्टेंट थिंग, बिकॉज उनकी फैमिली में किसी को हुआ था, उनके थ्रू उनको हो गया है, ठीक हो गए हैं, और कैंसर का ट्रीटमेंट भी चल रहा है और कोविड का ट्रीटमेंट भी खत्म हो गया है उनका, दे आर इम्यूनाइज. सो आई थिंक दैट्स व्हाट वी आर टॉकिंग अबाउट. हम लोग उनसे देख के निराश नहीं होंगे कि 4,000 लोगों की डेथ होती है. हम वो 4,000 में से नहीं है, हम वो 4 लाख में से भी नहीं है. वो करोड़ों लोग हैं जो जिनको इन्फेक्शन नहीं हुआ है, जो कैंसर का ट्रीटमेंट भी ले रहे हैं और जीत रहे हैं, ठीक भी हो रहे हैं. हम उनके बारे में सोच करके हम अपना इंस्पिरेशन करें. और जो इसके लिए क्या क्या हमें करना है, और ये अकेले का काम नहीं है, ना मेरा है ना कोई डॉक्टर्स का है, ये सब मिलकर के करेंगे. आप खुद, आपके फैमिली और सब मिलकर के करेंगे, और पूरी सोसाइटी, तब जाके हम दोनों को ही अच्छी तरह से हम लोग जीत पाएंगे. एंड दोनों प्रॉब्लम्स काफ़ी सीरियस हैं. यानी कि कोविड एक तरफ है, जो मरीज को एक बार हो जाता है उसका बीमार होने की संभावना है. हालांकि लेस देन 5% आर गेटिंग सीरियस, एंड मरने की संभावना बहुत कम, अभी 1.5% से भी कम है. इंडिया में काफ़ी कम हो रहा है, इवन दो रिकॉर्ड्स में नॉट बी ऑल दैट एक्यूरेट, बिकॉज काउंटिंग शायद थोड़ी कुछ है गड़बड़ी, बट स्टिल इट इज़ नॉट एज मच एज इन द वेस्ट. एंड दूसरी तरफ कैंसर, इम्पॉर्टेंट चीज़ ये है, जब कैंसर को होता है, खास करके एडवांस कैंसर और तेज़ी से बढ़ने वाला, अगर उसका इलाज नहीं किया जाता है, ये मौत का कारण बन सकता है. और ये कैंसर कोविड के लिए नहीं रुकता है, कैंसर का कोई लॉकडाउन नहीं होता है. ये इम्पॉर्टेंट चीज़ है हमें समझना. आप कोविड को तो आप लॉकडाउन करके रोक सकते हैं, बट कैंसर को नहीं रोक सकते हैं. तो इस समय किस चीज़ का हमें ज़्यादा देना है इम्पोर्टेंस, कैंसर को या कोविड, एंड वही उसी के बारे में करेंगे. एक तरफ जो हम लोग हिंदी में बोलते हैं, एक तरफ कुआं और एक तरफ दूसरा वाला प्रॉब्लम, और यहाँ पर डेविल एंड डीप सी, एक तरफ बड़ा सा शैतान और दूसरी तरफ बड़ा सा समुंदर. और हमेशा सवाल, हर तरह के सवाल हमारे मन में उठते रहते हैं. एक चीज़ बता दूं, हर सवाल का इस मामले में शायद जवाब नहीं होगा. काफ़ी सवालों का जवाब है हमारे पास जो हम लोग दे सकते हैं, और काफ़ी हद तक हम लोग अपना कॉमन सेंस और हमारा लॉजिक इस्तेमाल करके उसका सॉल्व करेंगे. और कई लोगों को बोलता मैं कैंसर से डरता हूं और कोविड मुझे डराता है. मैंने सुना है कि कैंसर पेशेंट को होता है कोविड तो मर जाता है. ऐसे वाले होते कौन सा ज़्यादा खतरनाक है, मुझे कुछ समझ में नहीं आ रहा है. मैं क्या करूं. ये परेशानी लगभग हर एक पेशेंट को है, और जब वो कोविड का इन्फेक्शन को ठीक हो जाता है और कैंसर का ट्रीटमेंट शुरू होता है, फिर उनका यही कहना है, डॉक्टर साहब मैं तो बहुत डर गया था, पता नहीं क्या होगा, और अच्छा हुआ हम लोग ठीक हो गए. तो आज के बारे में जो हम लोग बातचीत करेंगे, अलग अलग सेक्शंस में मैंने किया है. हालांकि सेक्शंस का मतलब बुक का नहीं है. तो पहले तो सोचेंगे भी कोविड इन्फेक्शन को रोकना कैसा है, खास करके कैंसर पेशेंट्स, एंड इम्पॉर्टेंट थिंग इज केयर टेकर्स, उनको जो देखभाल करते हैं उनका भी सोचना है। और कोविड वैक्सीनेशन के बारे में काफ़ी सवाल है, और उसके बाद में क्वेश्चन आंसर सेक्शन 1 के डॉक्टर मेघना करवाएंगे। उसके बाद सेक्शन 2 में जो कैंसर पेशेंट के ट्रीटमेंट के बारे में, नया पेशेंट्स, पुराने पेशेंट और जो पहले थे मतलब पेशेंट और अभी सर्वाइवर हैं, और उसके बाद में उनके बारे में सवाल जवाब। एंड तीसरा वाला, अगर मान लीजिए कि कैंसर पेशेंट को ही कोविड होता है या केयर टेकर को कोविड इन्फेक्शन होता है घर में किसी को, उस समय क्या करें। और लास्ट में एक बात करेंगे टेली कंसल्टेशन, और कुछ एग्जाम्पल्स के बारे में बात करेंगे। एग्जाम्पल्स सब बहुत सारे हैं, कुछ ही मैंने केसेस लिए हैं, और इसके बाद में सवाल जवाब और डिस्कशन जो भी कर सकते हैं हम लोग। तो इस तरह से हम लोग प्रोसीड करेंगे। कोशिश ये करें कि अपना खुद का सवाल ना करें, जनरल क्वेश्चन पूछें, क्योंकि ये क्लिनिक नहीं है, डिस्कशन है। मुझे ये हुआ था, मुझे वो हुआ था, मैं क्या करूं, इस तरह का सवाल शायद सबके इंटरेस्ट में नहीं होगा। हम लोग ये कोशिश करें, मैं मेघना से रिक्वेस्ट करूंगा, जनरल क्वेश्चन ले, नॉट पर्सनलाइज क्वेश्चंस, राइट। सो इसकी जो रणनीतियां हैं, यानी कि जो स्ट्रैटेजी है, नंबर 1 कि कोरोना को प्रिवेंट करना है। सिंपल सा चीज़, कोरोना को प्रिवेंट। और हम लोग ये सोचें कि भी तो वो नहीं हो सकता है, बिल्कुल हो सकता है, क्योंकि हम ये अगर समझ लें, ये अच्छे तरह से प्रिकॉशन लेने से कई लोग भारत में प्रिवेंट कर चुके हैं। सिर्फ 4 लाख लोगों को हो रहा है। अगर ये बोलेंगे 4 लाख लोगों को हो रहा है पूरा हिंदुस्तान में, हम लोग कितने करोड़ लोग हैं, उनमें से 4 लाख लोगों को हो रहा है, इसका मतलब बाकी सब तो बच पाए ना। तो हम लोग वैसे सोच करके, पॉजिटिवली सोच करके कोरोना को रोके, और साथ में जिनको कोरोना हो चुका है उसका सामना करें, इलाज करें, जिनको कोरोना हो रहा है उसका इलाज करें, और कैंसर का भी साथ में सामना करना है। ये नहीं कि कोरोना हो गया तो कैंसर को भूल गए, ये चीज़ गलत नहीं करना, क्योंकि कोरोना और कोविड का इलाज हो जाएगा, उससे बच भी जाएंगे, बट कैंसर का अगर अच्छा रूप नहीं है, अच्छा तरीका नहीं है, उसको हम लोग बचा नहीं पाएंगे। उसके लिए कोई छुट्टी नहीं, कोई ईद नहीं, कोई दिवाली नहीं, कोई होली नहीं, और कोई लॉकडाउन नहीं। कैंसर का कोई लॉकडाउन नहीं होता है। तो ये समझ के दोनों को ही हमने सामना करना है। और ये कैसे करें, सेक्शन 1 में हम लोग ये बातचीत करें कि इससे बचे कैसे। तो एक चीज़ समझें कि कैंसर में क्या कोविड बहुत ज़्यादा होता है, ये जैसे डायबिटीज़ में होता है, हार्ट अटैक में होता है, वो भी एक रिस्क फैक्टर है, क्योंकि इनमें इम्यूनिटी थोड़ी कम होती है, इसीलिए कैंसर पेशेंट को ज़्यादा होता है। और ये मैं कहूँ, दुनिया भर में पिछली बार जो हुआ था पैंडेमिक और इस बार के पैंडेमिक में काफ़ी फ़र्क है, क्योंकि बहुत ज़्यादा लोगों को इस बार हुआ है, इसीलिए काफ़ी कैंसर पेशेंट को भी हुआ था। इसके आंकड़े या नंबर्स थोड़ा दिन के बाद में आएंगे, उस समय हमें पता चलेगा कि क्या क्या हुआ था। बट कैंसर होने के बाद में उनको कोविड होने का चांसेस ज़्यादा है, ये मान लेते हैं फिलहाल। और जब होता है उनको, कॉम्प्लिकेशंस के भी प्रॉब्लम ज़्यादा हो सकती हैं, क्योंकि इनकी इम्यूनिटी कम होती है। और जब कॉम्प्लिकेशंस हो जाती हैं, उनको वेंटिलेशन का ज़रूरत ज़्यादा पड़ सकता है, और वो लंबे समय तक बीमार रहते हैं, और उनकी डेथ की प्रोबेबिलिटी भी थोड़ी सी ज़्यादा होती है। नॉर्मल पॉपुलेशन में अगर ये आंकड़े 2% से कम हैं, इनमें शायद 5%, 7%, अगर एज बढ़ जाता है वो 20% तक भी हो सकता है, खास करके जिनको लंग कैंसर और काफ़ी बुजुर्ग हैं, काफ़ी पहले से बीमार हैं, और उनको दूसरी बीमारियां भी हैं साथ में। तो ये सब तो जानते हुए, नंबर 1 कैंसर पेशेंट को कोविड ना हो, ये कोशिश हमारी पूरी होना चाहिए। इसीलिए प्रिवेंशन इज़ बेटर देन क्योर, ये हम लोग समझें, और कोविड इसके पूरे पूरे प्रिकॉशंस पालन करना है। और हम जानते ही एक तरह से ये वायरल इन्फेक्शन है, और ये वायरल इन्फेक्शन जैसे हमारे गले में जाता है, और गले में काफ़ी देर बहुत तेज़ी से बढ़ते रहता है, नंबर्स 1 से 2, 2 से 4 बहुत तेज़ी से बढ़ता है, और बढ़ने के बाद में हमारे गले में रह जाता है। और जब भी हम लोग खांसी करते हैं या छींकते हैं या बातचीत करते हैं, वो जो थूक की छींटों में अंदर ये छुपा हुए होते हैं, और वो छूट जाते हैं, वो आगे गिर सकते हैं, हवा में आ सकते हैं, आपके ऊपर गिर सकते हैं। इसीलिए ये सब प्रिकॉशंस लेना है। और कुछ समय तक ये भी बताया गया है, कुछ समय तक वो हवा में ऐसे रहते हैं, बहुत कम समय तक, मे बी कुछ मिनटों तक। और उस समय मान लीजिए कि कोई कोविड पेशेंट है और वहाँ पर उसने खांसी किया है, उसके बाद में आप तुरंत उस कमरे में ना जाएं, उस कमरे में थोड़ा देर के बाद में जाएं, पूरा डस्ट सेटल हो जाने दीजिए, अच्छा सा सैनिटाइज करके जाएं, ये इसका मतलब है। और उसी कमरे में अगर एसी है, एसी खुला होना चाहिए। अगर कमरा बंद है तो काफ़ी देर तक रहेगा, हवा का झोंका नहीं आएगा। अगर आपका खुला हुआ है आउटडोर्स में, इसकी इन्फेक्शन थोड़ी कम होगी। तो ये सब प्रिकॉशन जितने भी हैं वो इसी बेसिस पे हैं कि ये क्या करना है। और हम लोग पर्सनल मेजर्स क्या लेंगे, ये तो हर टीवी में हर दिन हर जगह पर आता है। एक तो नंबर 1 अपनी साफ सफाई खूब अच्छी तरह से रखना है, ताकि आपके ऊपर जो अगर गिरे किसी के छींटे तो क्या कहते हैं, आप अच्छी तरह से सफाई करने से वो कम रहेगा। जब भी कोई नया आदमी मिलता है, अगर आप ये समझेंगे ये कोविड, इनका पास में इन्फेक्शन हो सकता है, इनके मुझे नहीं हो सकता है, मेरा बेटा हो सकता है वो मेरा दोस्त हो, खास दोस्त हो, तो भी वो उसको कोविड हो सकती है, ये हम लोग जान ले। मैं जानता हूँ इसको कोविड नहीं हो गया, बाहर नहीं गया है, ये बिल्कुल गलत बात है। ये चीज़ नहीं करना है। आप ये मान के चलिए, चाहे आपके घर में भी रहते हैं, आपका बेटा है, सुबह गया शाम को वापस आया, हो सकता है वो कोविड लेके आया हो, सब्जी के टाइम में लाया हो, बैंक के टाइम में लाया हो, अपने ऑफिस के टाइम में लाया हो, तो इनसे दूर रहें, मास्क पहने। ये चीज़ अच्छी तरह से अगर समझेंगे हम लोग तो हो रहा है। आपने देखा ही होगा, जिनको घर में एक को होता है तो पूरा फैमिली को हो रहा है, क्योंकि इस वायरस का जो म्यूटेशन है बहुत जल्दी जल्दी वो करवा रहा है और सबको फैल रहा है। इसीलिए इसको दूर रखें। खांसी करते हैं, जो भी स्नीज करते हैं, छींकते हैं, तो अपने हाथ को अपने पास में रखें, मास्क के अंदर छींकें और मास्क उसके बाद में बदली करें। और इसका ध्यान रखना है कि जब भी हम लोग छींकते हैं या खांसी करते हैं या बातचीत करते हैं, अपने छींटे दूसरे के ऊपर ना पड़े और दूर से बात करें, दूर कम से कम 2 मीटर की दूरी। जब भी हम लोग 2 मीटर क्यों रखा गया है, जब भी हम लोग खांसी करते हैं, छींकते हैं, 2 मीटर तक छींटे जाती हैं, वो आपने देखा होगा, वहाँ तक वायरस भी जा सकता है, इसीलिए वो ज़रूरी है। जो अपने खाने के बर्तन हैं, जो सब चीज़ें को एकदम साफ सफाई। और एक इम्पॉर्टेंट चीज़ है मास्क पहनना। अगर मान लीजिए वो हवा में घूम भी रहे हैं, आप मास्क पहनेंगे, वो मास्क के ऊपर आके ठहर जाएँगे, आपको अंदर नहीं आएँगे। अगर आएँगे भी तो कम मात्रा में अंदर जाएगा। ये मास्क एकमात्र आपका एक बहुत अच्छा बचाव का वो मीन्स है। इसको आप अच्छी तरह से सँभालें। और डबल मास्किंग, जो अभी थोड़ी देर में बात करेंगे, डबल मास्किंग कुछ कंडीशंस में आप कर सकते हैं। तो यानी कि किसी से हाथ नहीं मिलाएं, बार-बार हाथ धोएं, खास करके जब कोई भी चीज़ को आप हाथ लगाते हैं, किसी से मिलते हैं, किसी के पास में जाते हैं, किसी को छूते हैं, तो आप ज़रूर अपना हाथ धोइए। हाथ धोने से बिल्कुल साफ-सफाई अच्छी तरह से कम मतलब जो टाइम बताया गया है, कम से कम 40 सेकंड, 50 सेकंड, 2 मिनट तक आप अच्छी तरह से हाथ धोएँ और हर तरह का हाथ धोएँ। ये बहुत इम्पोर्टेंट है। ये नहीं कि पानी के पास जाएँ, ऐसे-ऐसे कर लिया और उसके बाद में हाथ धो लिया, ऐसे नहीं। साबुन और पानी के साथ में अच्छी तरह से। और साथ में मास्क हमेशा ज़रूर पहने। और जब भी कोई शक लगता है कि किसी को इन्फेक्शन है, वो अपने आप को क्वारंटीन करें। और जब भी किसी से मिलते हैं, खास करके घर में कोई मेहमान भी आते हैं, बाहर से कोई आता है, और अपने ही खुद के ही रिश्तेदार हों, जो भी आते हैं, उनको बिल्कुल दूर रखें, 2 मीटर की दूरी पे, तब जाके उनसे आपको इन्फेक्शन नहीं लगेगा। और ये साथ में बाहर अगर जाना है, कोई क्राउडेड प्लेसेस में आप बिल्कुल नहीं जाएँगे। ये बेसिक सिंपल कॉमन सेंस की है। कोई इसमें साइंस, मतलब साइंस से पूरा जुड़ा हुआ है ही है। इसमें कोई बड़ी वाली चीज़ें नहीं है जो आप नहीं कर सकते हैं। ये चीज़ें करते रहेंगे अच्छी तरह से, तो आपके पास ये कोविड इन्फेक्शन नहीं आएगा, ये ध्यान रखें। और ये है डबल मास्किंग। मास्क जब भी पहनेंगे, नाक के ऊपर पूरा होना चाहिए और नीचे चिन को अच्छी तरह से कवर करें और उसके ऊपर। और अभी आजकल का रिकमेंडेशन है कि डबल मास्किंग करें। वो इसलिए, अगर एक, क्योंकि इन्फेक्शन बहुत ज़्यादा हो रहे हैं, किसको है पता नहीं, क्योंकि अभी मैं हॉस्पिटल में जाता हूँ, हॉस्पिटल में जाने के बाद में ये पता चलता है, सर आप जिनके साथ में बैठे हो तो उसका पॉजिटिव आया था। सो यानी कि इतना इतना वो इन्फेक्शन रेट हो रहा है। इसीलिए खास करके अपने डबल मास्किंग करेंगे तो अपने आप को प्रोटेक्शन कर सकते हैं। कई बार हम लोग मिलते हैं, कोई पेशेंट से मिलते हैं, सर वो पेशेंट आए थे, उनका कोविड टेस्ट कराया, उनका पॉजिटिव निकला। अब पेशेंट तो बिल्कुल ठीक-ठाक थी, कोई तकलीफ नहीं था, कोई खाँसी नहीं, कोई बुखार नहीं, कोई कुछ नहीं, कहीं बाहर भी नहीं गई थी। बट इन्फेक्शन अपने घर वालों से किसी से हो गया है, और उनसे बचने के लिए हम लोग डबल मास्किंग करें. यस.
Doctor, I'm sorry to interrupt you. There's quite a few in the audience who request you to shift to English because they're
English. Okay,
unable
fine.
to
All right,
understand.
fine. Okay, so we should
Thank you.
have double masking each time, and double masking will prevent the infection to reach your throat, and that's why it happens. So double masking is very important. So 2 layers. An important thing is when you wear a single mask, then the protection is about 75-80%. But when you're making a double mask, the protection is about 95%, and they should be tightly fitting. One can be a cloth mask and another can be a N5, or both can be good cloth mask, especially with a filter. So it's very, very important that it should be covering your mouth completely, and then you should have a good protection with this. And this should be worn all the time throughout. And even at home, please wear your masks at home so that you never know who is having the infection. A person, maybe your servant, all the time he's staying with you, but then he is going to the market, he is going to get your vegetables, and then when he's getting the vegetables, maybe he's got the infection from them. So therefore it's very important that you wear the mask at home. Your own son, your own brother, your own husband, your own wife, she could be or he could be getting that infection from outside. So be careful. And then you should be, at least, because many people are getting at home, so that's important. So this is the important thing, is double masking. So double masking have two more layers of washable breathable fabric, completely cover your nose and mouth, and it should be fitting snugly the face, and don't have gaps. Don't have gaps in this, and don't use those valves. And as far as possible, don't use any valves. They should be there. And then you have to wear it throughout. Very important, and you should be comfortable wearing it. And then supposing you being a patient, you may have to go to the hospital for anything, whether for COVID or whether it's for cancer. It's very important. So first thing is maintain the distance of 2 feet, definitely, from each other. Don't start in a queue where just immediately behind the person. One. Second thing is, before going there and after coming there, carry a sanitizer throughout. And if you touch the handle, if you touched a person, just wash off your hand, because the virus may have got onto your hands. Important, immediately you wash your hands with the sanitizer, and if you have the access to the water and the soap, you could do that. And then wear a mask throughout. Don't even ever say that मेरे को बहुत घुटन हो रही है, मैं निकाल देता हूँ 1 सेकंड के लिए. That is enough for the virus to get inside. That's important. Then keep now all of us, 6% of the 6 patients, one out of 6 will be having diabetes in India. Somebody will have blood pressure, and all these things must be under control. So we forget about the diabetes. Is not fair. So if you have diabetes, if you have blood pressure, if you are taking heart medicines, please continue all the medications. And then your dietary precautions, whatever you're taking before, whether it's salt restricted, diabetic diet, and whatever restrictions, if you have kidney problems, kidney diet. So all these things must be continuing. Don't forget that these can be forgotten. The moment you keep them under very good control, diabetes, and then what happens is your immunity is better, and then you can actually prevent this corona infection. And you can, even if one does have it, the complications will be much less. So do not forget your medical problems. Keep them all under control. That's a very, very important. And you must be having your family doctor, and then please be in touch with the physician. Tell him that sometimes I hear the patients of diabetes, हाँ हाँ सर मैं तो बहुत टच में हूँ, आप लास्ट कब गए थे उनके पास में, अभी अभी तो गया था, कहते हैं. Then suddenly they say that is June and they're talking of in January. 6 months back they went, and they thought the 6 months is a short time. No, it is not. You must be in touch with your physician very frequently. Rather, I would say all of you, those who are having medical problems, just touch base with your physician, have a chat, sir, everything is under control, and then I'm okay with the medicine, so that you can check and then be sure that all the things are fine. Monitor your pulse, BP, respiration. You don't have to be panicking about the oxygen each time. Only in case you have fever or symptoms of COVID, or you have some lung problems, only then you monitor your oxygen, otherwise not. And one important thing is, while you're at home, while you are taking all the precautions, it's very important for you to be physically active. Now, one you can ask, I don't have park, मेरे पास ground नहीं है, मेरे पास जगह नहीं है. आप खड़े खड़े उसी जगह पर you can actually be physically active. Jog while you're standing, do some standing exercises. I think that's a very important thing, that you must be physically active. Spend half an hour, 1 hour, 2 hours, do some sit-ups, do some yoga, do some breathing exercises, do some prone breathing and all that. So important thing is that you must be physically fit and physically active, and that is very important to keep away the corona. And then you, in your room or house, no outsiders, no servants, no visitors, very important. Even if they come from outside, you can do that. Clean and sanitize the whole place that the other person has come in. And even the cook, in case you have given them some cup of tea or anything, cook utensils, everything, you must be washing them properly. Be in touch with your people on the telephone, not personally. Entertain yourself. Don't keep thinking, don't keep looking at those news which are disappointing, sometimes distracting, sometimes distressing. So entertain yourself in whatever, listen to music, watch a good movie, and then in whatever way you can do that. Go through your old albums. If you have some hobbies of singing, anything, you can do that. Physical exercises and prone breathing, I have already told you, that is very important. In your own house, yourself, your spouse, your children, if you have any personal helper, they must all be taking care of yourself, and everyone must be looked after. And then they should be having a self isolation in case they have any symptoms. Just do that. The moment you have fever, don't wait for the COVID test. The moment you have fever, straight away isolate yourself, and then say, okay, let me observe. Let the COVID test come negative. You be this, ensure that this fever is not because of COVID, then come back to the people. Don't keep thinking मेरा COVID नहीं आया, अभी तक तो मैं इनके साथ में रह सकता हूँ. Please don't do that mistake. And that is the time when you will be transmitting the infection to all your family members. They are all your own family members. So you should be very, very careful about them. So in case the people are having suspected or confirmed COVID at home, please take care of yourself and the family. For the caregivers, first thing is, even a sick person, an elderly person, give them good nutrition, good fluid, and good nutrition. And everything must be given. Remember that all whatever diet has been recommended for him should be given, diabetic diet or renal diet. And don't forget that fluid bola hai kidney wale patient ko ya heart patient ko bhi बहुत सारा पानी दे दिया, that's not the right thing. Keep all those things in mind. Wear a medical mask, double masking, wear a cap if required, a PPE in that room whenever you go there. And then don't touch the mask or face during that particular stay there. And the moment you come out of the room, discard it, because you need to have help him or your aunt or grandmother, whatever the person is, and then you have to help them. You have to take care of them, and immediately you have to take care of yourself also. So discard all the things completely. And then after that, clean your hands with soap and water, or the alcohol based rub, especially after the contact of the ill persons, before, during, and after preparing food, before eating, and after using the toilet. These are basics you must do. And whatever utensils you have used for that particular person, let him also rinse if it is possible. Otherwise, use dedicated dishes, cups, and whatever utensils for them, bed linen, and then wash all of them completely separately with soap and water. That's a very important. It's actually common sense. It's important, logical. There's no science behind this, just simple general cleanliness. Tips are that, in case if whatever places which are touched, door handles, keep sanitizing them many times in a day, not just once. सुबह साफ कर दिया, अभी ठीक है, शाम तक नहीं रहेगा वो. Maybe somebody is touching the handle very frequently, so you be very careful that the outside handle, inside handles. And then if there is any problem, just talk to your healthcare facility or doctor or whoever is a nurse or somebody. Please talk to them immediately. And then these are all the WHO guidelines, which I basically the same: isolation, taking care of the sick person, monitor them with all the parameters that you can think of: pulse, BP, temperature, oxygen, and so on, and reduce the contact with the outside people and with even the patient if the person has some COVID infection. So, but you must take care of the person. And then the danger signs: understand the danger signs: difficulty in breathing, loss of speech or mobility, confusion. Sorry, just go back to that. And then confusion, chest pain, a lot of cough. So these are all the danger signs. Drop in the oxygen. Most important thing is, don't panic. because COVID infection does not mean that you have to get admitted to the hospital and only hospital mein hoga, ghar mein nahi hoga, galatfehmi hata do. You can actually be treated at home even if you have a moderately severe COVID infection. People have become all right at home and they don't require hospital. Oxygen can be given if required at home. Cylinders can be provided. Oxygen concentrators are available now. So many things are there, and the medicines can be taken on the telephone. So he can be managed at home very much. And a lot of people have taken actually. Coming to the next important thing about the vaccination is it is safe. It is a must for every patient of cancer, irrespective whether they had it in the beginning, they are having it now, or they are having. This is what all the world's experts have said it. Don't be scared of side effect. Don't believe the rumors that it does this, it does that. I heard this, I heard that, and WhatsApp says this. Stop those rumors. Stop believing them. Stop spreading those rumors. Consult your doctor if there's any problem. And then this is just one of the patient that you, as a lung cancer patient, he's more prone. So therefore, the vaccination has helped him. The vaccinations, once taken, they prevent the high morbidity, that is ICU admission and so on, high mortality, that is death rates. It gives a herd immunity and then prevents the ongoing transmission. So what happens is, if a lot of people are vaccinated, in that case, the community will not get much of infections. If only few people are vaccinated, the infections will spread a lot in the community, and that's what is important, and that's what is happening in India at the moment. But I'm sure the situation is going to improve very soon. So when a person is vaccinated, the risk of infection is reduced. It is not brought down to zero. Please don't think that you will not have infection. You may have infection, but the infection will be mild and very short, and it doesn't make you serious. It doesn't make you sick. It doesn't allow you to die. That is the important thing of the vaccination. And also, please remember that by taking vaccination, you still could get infections and pass it on to others. So therefore, continue with all the precautions that you're taking. Now, you may ask me a question. In Israel and in US and in other countries, they have removed the mask. We have not come to that stage of removing the mask after the vaccination. We are far, far away. I think the total vaccination percentage is less than 3 or 4% of the entire Indian population. So we are far away from the 40, 50% or 60% of the 90% in Israel. So I think we are far away from that. So therefore, we are not going to remove the mask just because US is doing it in their place. So don't get into that. So benefits, I'm just summarizing, benefits of getting the COVID vaccine to a cancer patient or any person for that matter, is that he doesn't get very sick. That's very important. It protects others. If you are getting vaccinated, not only you protect yourself, but you will also protect the people around you. And then you are preparing for the unknown. What is going to happen, we don't know in this kind of pandemics. So therefore, you are preparing for the unknown. You boost up your immune system by producing the antibodies against the virus, and it stops the spread from you to other things, and it controls the pandemic. And that's one of the best tools available today. So patients who are cancer patients, if they are taking some anti-cancer therapy, also must have the vaccination. That is one important recommendation all the experts have said. You can delay it by 1 or 2 weeks after a major surgery, so that you are not confusing the fever from the surgery. Any surgery after 2, in case you're not vaccinated beforehand, please take the vaccines 1 or 2 weeks after the surgery. That's important. And then wait for the absolute neutrophil count recovery after the intensive. Supposing you've taken the chemotherapy, wait for the white cell count and the neutrophil count to become normal, and only then you take it, so that you can check from your oncologist or check from the reports yourself. If you've had a transplant of the bone marrow or any other therapy of the something like a CAR cell therapy, which is not happening so much in India, but the bone marrow transplant happens, wait for 3 months. Wait for 3 months and check from your hematologist or oncologist as to when you can have this vaccination. And then whenever the vaccine is available, whatever treatment you're taking, whether it's you're getting chemotherapy, targeted therapy, immunotherapy, and radiation, please have it. And I have seen many people are not had vaccination when it was open a month ago, 2 months ago for the 65 and above, but nobody took it. Very few people are taken. Now suddenly they are going and then vaccine is not available. So therefore, I think be sure that you take it right now without wasting much time, without thinking much time. So this is applicable to previous patients, current patients, all the new patients, anyone who's got cancer or otherwise also. So many myths are floating around that the vaccine are not safe. They are safe, proven all over. And then they have been made too quickly. Yes, but that was a need of the society. And therefore they had had an emergency approval. If you ask that we don't know the long-term effects like other vaccines, we will come to know in the thing, but they are very safe for all the patients. You can get COVID-19 from the vaccine, absolutely wrong. Nobody will get the infection of COVID-19 from the vaccines. Vaccines will change their DNA. No, they don't. Neither the virus changes nor the vaccine change. They don't do anything. Side effects from the vaccines are severe. No, they're mild. They are just like any other flu vaccine. Some side effects like fever, body pain, which are short lasting. So they are not at all severe. And then you have food allergies. It doesn't mean that you should not have vaccine. You can have the vaccine even though you're allergic, unless you are allergic to another kind of vaccine. Then you discuss with your people. But even all kinds of allergy, मेरे को तो इससे allergy है, मेरे को उससे allergy है, मेरे को इससे allergy है, you can still have the vaccine and you should have the vaccine. Vaccines will make infertile and so on, all nonsense. I mean, they have no basis. Anyone can think anything, and that's not right. So they don't. So conclusions of this section are: prevention is possible and better. Simple measures which can be followed, and they should be followed. Vaccinate yourself, and if you're sick, get tested, and if required, isolate yourself. So then I stop here this thing, and then these are all in Hindi, just the same thing, that yoga and then meditation. I think do that so that you de-stress yourself, keep yourself physically fit, and then do pranayam or do any breathing exercises, prone breathing, so that you keep your lungs fit. And then every day you do the indoor exercises, all the precautions you must follow, and then have balanced diet, fluid diet. Very good sleep is important. Don't lose your sleep over the COVID. And don't panic, don't get into tensions, stop worrying, because worry has not cured anything in the world. So that worry is not going to take away the risk of COVID. By worrying more, maybe you can drop your immunity, and vaccinate yourself. These are the basic simple things. So now we can, before we go on to the section 2, and request Meghna to conduct any questions.
Yes, sir. Thank you, sir. That was very informative. I think that already answered quite a few questions that I had, the basic questions.
Right.
One question that I'll ask, there is a person asking, as doctors say that cancer cells multiply rapidly, will there be any chance that these cancerous cells carry the COVID virus along? And does it help in replication?
No, they don't. So the cancer and the COVID threat, they're two independent processes. They multiply together. So they're differently, they don't intermingle with each other. Virus multiplies separately. And like, for example, cancer infection. So why are we talking so much? A cancer patient can get TB. A cancer patient can get a pneumonia. A cancer patient can get any infection. And in fact, they're more prone to infection than most of the other patients. So therefore, infections happening in a cancer patient is nothing new.
Yes.
So it's not new. And then medical oncologist, a doctor who's treating with the cancers, he's treating with the infection, it's treating the infections left and right all the time, whether it's a pneumonia, whether it's an infection in the urine, an infection in the abdomen. So infections are a part and parcel of a cancer patient a lot of times. So then this COVID infection is just another infection. So they have nothing. The cancer cells and COVID cells are the COVID virus, they're completely independent.
Okay. And I think this has already been answered, but I'll just repeat it. What is the right interval to get second dose of Covishield?
Okay, so now I think earlier it was 4 to 6 weeks, then 6 to 8 weeks, and now they say even up to 3 months or 6 months also is fine. I mean, let them come out with the data, because I think whatever the company and whatever the experts recommend, I think we should just follow it. And one important question which I've been facing from my patients, my friends, and my other people are that, okay, I have taken it 4 weeks, what will happen to me? Let us understand the difference. If the protection was declared at 75%, for example, after 4 weeks of the second dose, when second dose is being in 4 weeks later, what they have found is, in case you delay the second dose, the protection improves from 75 to 85 or 90%. Right? So now the if they are taking, now they may say, okay, fine, iska matlab I am less protected. But important thing is you still have 75% protection there. So don't worry about it. If you have already taken 2 doses, now a time will come, maybe after 6 months, after 1 year, when all the people have been vaccinated, there may be a booster dose after 6 months or 1 year. Let us wait for that moment. Let us wait for that moment. When it comes, we will have it. But don't stop. I mean, don't keep thinking that, okay, I am less protected, so everyone is protected. Those who have taken the vaccinations, the percentages may vary, and once the whole society is vaccinated, I think all of us are better protected. So don't worry about it. Follow whatever the instructions keep coming, whatever advices keep coming by the government, by the experts. We'll wait for that.
Okay, sure, sir. Thank you. I have a question from Rahul asking, can cancer patients wear any kind of a mask, or is an N95 mask mandatory for them?
Double masking, 2 cloth masks, one N95, one cloth mask is adequate. I think that's important. And I would advise the patients to even use gloves, use caps, and also in case required, PPE, for example, the whole protection. I've seen a lot of patients having the PPE and coming, it makes them safer, because and after that they're all disposable. I think it, by using, especially the elderly patients, sick patients, diabetic patients, I think it's no harm in using that, because you never know who's going to infect. The infection load is high in the society, and so also in the hospital.
Okay, sure. Cancer patients are low on immunity and need extra protection during pandemic. So what extra precautions are we talking about?
Thank you for that's a very common question. So how to improve the immunity for a normal person and how to improve the immunity in a cancer patient? We must know that immunity is not by taking some one particular thing my immunity goes up high. Immunity is a complex function in the whole body. It has got multiple things, like for example, if I'm bitten by a mosquito, whatever the infection is given by the virus, it can be eliminated by my immunity. Similarly, something which I'm inhaling through my mouth and lungs is also removed because of the immunity. If I come in touch with something, I eat something, my immunity protects me from that. So immunity is multifaceted. It is not one thing, and it is a result of many things which are happening in the body. Important thing is a balanced diet. So there is nothing extra that you need to have. A balanced diet means everything. It must have good vitamins, good minerals, good proteins, good carbohydrates, good amount of fats, good amount of everything. So balanced diet is very important thing. That is one. Second thing is a good sleep. Why good sleep? Because in the sleep only the immune cells are active, they are multiplying, they're able to clean up all the dirt that we have accumulated in the daytime. So if you have less sleep, 4 hours, 5 hours, then it is bad. And it has been seen, the people who don't sleep well, the immune functions are low. The people who sleep in the daytime and are awake in the nighttime, again, their immunity is low, because our body is made to sleep and rest in the nighttime and work in the daytime. The people who have been doing night duties excessively, they have been found to have not only less immunity, and then on the long run they have more cancers, because the immunity can even flare up the cancers, more infections, more problems. So therefore a good sleep is very essential, very, very essential. 6 to 8 hours of sleep, depending on your age and kind of a physical exercise. And then more important thing is exercise. Exercise is very important to maintain the immunity. And then it doesn't come, the immunity doesn't come by taking 2 teaspoonfuls of some chawanprash and mere ko immunity acha ho gaya hai, and the whole day you're sitting in front of the TV and doing nothing, eat all fats, your immunity is not at all good. You may take chawanprash, but do all these things, and you can convince yourself, in case you think the chawanprash, whatever. So these immune producing foods is all bakwas. I mean, it's not right. Immunity is a function of the whole, everything that we do in ourselves, including cleanliness. If we get in touch with the dirt and don't wash ourselves, what immunity we're talking of? I mean, we are actually getting exposed to the infection. So cleanliness, personal hygiene, good sleep, good exercise, balanced diet, and then these are important things in life. to maintain a good immunity. And so that's about the immunity part. So no special precaution, but doing general healthy life is the most important thing for them.
Yes, yes. The recent finding of Covishield and blood clots. What is the percentage of patients getting blood clots from Covishield?
Very less, very less. I think that's not really and then nobody has got the exact details, but it's very less. And actually what is happening today is anything what is happening, it's put under microscope, blown up, and then circulated through WhatsApp. A lot of misinformation is going on. Nothing like that. So many people have got in India. What happened? How many people have got I think we have got how many, 17, 18 crores have been vaccinated. I think nothing much has happened. Have you heard of any such things? They're all
Not
in the
really.
WhatsApp, so therefore
Yes.
nothing happened. Yeah.
Is there a chance of mucormycosis infection in cancer patients if they get infected by COVID?
Okay, so mucormycosis is an opportunistic infection. Whenever the immunity of the body becomes less, the fungus which is there, it can take over the whole body and then cause infections. The mucormycosis is not something which has come in the COVID era. This has been existing. This has been seen in patients who are grossly immunocompromised, in AIDS patients. It's been seen already. The incidence has been less. And then now, because COVID infections are too many, and then a lot of people are getting sick, and a lot of people are in the ventilators much more than ever before, we are finding them more. Absolute numbers a little more. So it is nothing new. And then don't think that no, it will happen to everyone. The people who are elderly, who are sick, who are diabetic, who are grossly immunocompromised, have been used excessive steroids. These are the people who may get mucormycosis. So don't keep thinking. And it's a it's yes, it is increased a lot in these patients. And because of the even in the ventilation, we used to have a lot of infections. So I think this is just one of the infections which happens in these people. Don't think too much of it. This happens only in sick people.
Okay. So I have a personal question. This is because I have a lot of people who ask me regarding this.
Yeah.
So talking about immunity and having a balanced diet, I know quite a few people who, self-administered or self-prescribed supplements, multivitamins and all that. They've been self-prescribing themselves. And what do you say about this?
Right.
Is it necessary that they consult?
Yeah. If you see the WHO declarations, they have said that one of the most misused medicine in the world are the multivitamins. And then multivitamins make two people very rich, two things very rich in this world. One is the manufacturer who sells them. So if you buy them, he gets a lot of profit and he becomes rich. That there's no doubt. And the other thing which gets enriched is the toilet. Whatever vitamins are required in our body, they are taken care by our thing, because most of the vitamins are water soluble. And then excessive vitamins are excreted in the urine and the toilet. They are just thrown out of the body like junk. So therefore the toilet gets enriched by the vitamin that you consume excessively. So therefore you enrich the manufacturer and enrich the toilet with the vitamins. That is what the common saying is. Sorry for using that word, but it's all junk. When you take fruits, vegetables in sufficient quantities, you take normal cereals, normal things, it's complete balanced diet. I mean, we can go into the things separately, but a good balanced diet will provide you everything. You don't require extra supplements, extra vitamins and calcium supplements in elderly people, postmenopausal. Yes, if you want, you can take once in a week or twice in a week or thrice in a week some multivitamin pills. No harm in taking it, but don't take unnecessary medication. They may even do harm. A lot of them have steroids, a lot of them have heavy minerals, heavy metals, so they may be harmful in the long run. Please do not take anything whichever you do not know. Just because so and so उन्होंने बोला बिल्कुल safe है, उसको मान लिया आपने, कोई, it's not right.
Thank you, sir. Thank you. I think that's all the questions we have for now. We can continue with the next
Yeah,
section.
so I hope you're okay with the time. Just look at the time, because the next sessions are very small. I mean, they're not very long. So cancer treatment in the COVID time. So this is just to see how cancer patients should take the cancer treatment. So important thing is that the cancer, we already know that the cancer patients can get more COVID infections, they can become more serious and bad consequences. So therefore we should prevent it. That's something, and that we already discussed this slide much before. And then I have divided the cancer treatment in 3 sections. A person who has had cancer in the past and now free from cancer may or may not be on some kind of a hormonal treatment and free from cancer, may be required to go to the hospital for 3 months or 6 months or yearly checkups. So that is one category. Second patient is the cancer patient who is on active treatment today. And the third category of the patients are new patients who have just been diagnosed. So 3 categories of patients, one by one I will deal with. So the people, sorry, because this is all made in Hindi, thinking that no, a lot of Hindi speaking people, but I'll keep talking in English. And so most important thing to realize is the cancer-free patients or cancer survivors, if they are normal, having no symptoms because of cancer, because of COVID or anything, he is or she is safe. All they have to do is prevent the corona infections, and then in case they are due for some tests, you can postpone the test to a safer time, 1 month, 2 months, because of the, so that you minimize your travel. You must minimize your travel, whether to the hospital or even to the outside. ये नहीं कि सिर्फ हॉस्पिटल नहीं जाना है, बट मैं तो पूरा बाजार में घूमूंगा, मार्केट में जाऊंगा, मॉल में जाऊंगा, शादी में जाऊंगा. That's not right. So travel to any place, you must do less, and whatever medication that you are on, continue those medication, and then keep in touch. Supposing you're due today or tomorrow for the checkup, talk to the oncologist. Sir, I'm due for the checkup. What should I do? Can I postpone it? And then so you can discuss. So symptom free, you are absolutely safe. All you need to do is you can postpone your test in case the oncologist agrees, take your medicines and prevent the corona, and travel the least, and that's the most important thing. All the precautions are applicable to you. If you are having any symptoms of any kind because of cancer, because of the COVID, anything, just discuss with the oncologist. With this, not the right place to discuss each and every symptom. So that's about the patients who are cancer survivors. The patients who are on active treatment now, so what should they do? Suppose, I mean, we've had many patients, I will discuss in the examples also. Till whatever is possible, as long as possible, please continue your treatment. That is what all the experts have said, because the COVID will come and go away, the pandemic will go away, cancer will not leave you. If not today, next year. In case you don't tackle it well, the cancer is going to remain in the body and then trouble you, or maybe take your life away. So that's not worth keeping it like that. So as far as possible, whatever treatment you're taking, continue with the treatment. And in case any change is required in the treatment, let your oncologist, you can ask your oncologist, is there any other safer alternative which is equally effective for me at this moment? Please ask him upfront the question. In case he does have it, he will suggest to you that. And then you choose nearest hospital. You don't have to go from here to US or Bombay or some place to the other. You can have it in the next door, any hospital whichever is next to you. Please do that. And then you can be in touch with your treating oncologist wherever and however far he is, and then be in touch with the local oncologist. A lot of people are doing it. Please do that. And then travel the least for whatever reason, and take all the precautions, important thing. And then whatever things that then you just discuss with everyone. Don't take your own decision. I don't want to take the chemotherapy, I'm very scared. So all the experts in the entire world are saying this. So this is the important message which I want to give to the cancer patients on treatment. Whether it is radiation, you continue that. Whether it is chemotherapy, you continue that. Surgery, whenever it is required, choose a COVID-free atmosphere, COVID-free hospital. Ask the risk of contracting the COVID. All surgeries are safe, but the safety is about the COVID, the thing that you have to take. So you can ask your surgeon and then take a decision about that. And then whenever you are on treatment, you choose a non-COVID hospital, and then where specialists and facilities are present. All the precautions for the COVID must be there. In case you have problems, or even if you don't have problems, if you have an atmosphere, a lot of people are going in and out of the house all the time, isolate yourself so that you don't get the infection. stay away from all the other people. They have to do their work. Your son, your son-in-law, daughter, anyone, they have to work. So let them go for the work, but you isolate yourself, take all the precautions, don't come in touch with them, be in remote control, remote touch, and so on. And then have the cooperation of the entire family to look after you. And then whenever you're going outside, wear a PPE and take all the precautions as we just discussed. So this is the patients who are in active treatment. That's a very important thing. Now, about the new patients who have just been diagnosed. So in the COVID times, what happens? Many patients have got it, and then don't get tense, don't get scared, don't panic. That's the most important thing. First thing is finish all your tests required and recommended by your oncologist. If the biopsy is to be done, CT scans, PET scans, choose safe places, choose safe times, take all the precautions. And then especially when you're going to a diagnostic center, wear a PPE, be sure that they have taken the precautions adequately for the COVID, and then you can have it. And maybe you could be the first in the morning. The appointment also can be scheduled in the morning hours, so that it is clean system, because you can't stop a COVID patient coming to a CT scan. And then, so maybe you can time in such a way that, just check from them. And then once you get all the tests done, understand the cancer, and then from your oncologist, what kind of cancer is it, what is the stage of cancer, what are the treatment options, what treatment sequence are you proposing, and then what is the intention of treatment, is it curative, is it palliative, or maybe I could wait. And then all the possible things you understand. If you're not convinced, or if you still are doubtful, you can have a good second opinion and keep that, so that you take a thing and take time to decide all this very quickly. And then you understand one important thing is, in case you don't treat, what will happen. Get that question very clearly. In case you're not treated, what will happen to you and what will happen to the cancer. Kitna zaruri hai to get the cancer treated, very important. So to understand this, and how safe is the treatment, and then have a family discussion. But here I would say that, just because your grandfather has said it, or your guruji has said it, or your uncle has said it, and all the time you've been listening to him, just because he has said it, unhone bola chemotherapy nahi lena hai, I don't think that's the right thing to do. And if he just says because of his belief, his things, maybe it may not be appropriate. So I would say, take scientific, logical decision. Just don't I mean, endanger yourself because of this. And there will be logistic issues. You have to understand how to solve them. And then the complete decision has to be done by the patient himself. So, and then just want to make you understand that in case one person is not treated, sorry, in case he is not treated, the results are bad. In case the person is treated, the survival is better. This is just to see the difference in a patient who has been treated and not treated. There's a huge survival difference. You can just see that, here, no chemotherapy, the persons die much earlier. If the patient is taking chemotherapy, the patients are living longer. This is what happens in a stage 4 cancers of the GI. So therefore, you must also understand whether it's a fast growing cancer or a slow growing cancer, and then all the things you must understand, and then take the decision as to what to do. So what do the experts say about the cancer treatment in the COVID times? Let's understand this. So all the experts say it's a very difficult decision, but all the things, understand the stage, understand the type of cancer, and then important thing is, if it is required, please treat the cancer, and if it is not required, you can wait for the treatment. This is the basic message that they're giving. If it is required, please go ahead. It is safe in treatment. COVID times also, cancer treatment is as safe as there, but you have to prevent the infection of the COVID completely. That's the important thing. These are the recommendation of various things that you can have. If the treatment is not required, don't treat. And then if the treatment is required, continue to treat. So like that, all the decisions in the fast growing cancer, advanced cancers, you must treat. And then whatever treatment is required, please do that. And if some treatment has to be postponed, do that. So I have finished the section 2. And then any questions about this section, we can answer that.
So I think we might have a time crunch. So if we can finish this and then we can have all the
All right.
questions at once.
Okay, fine. So next one is a
Thank
very
you.
short one, and then that's about the teleconsultation. It's a very important part of the whole process today. Instead of going to the hospital, you can pick up the phone, mobile, whatever laptop, and then talk to them on the phone or audio, everything, and then do the thing. It's very advantageous. It saves your time. We'll just come to the advantages. Advantages many ways. And important thing is, it is, you don't have to travel for that. It is very cost effective. It saves your time. It saves a lot of time, and more important thing is, it gives you a solution from the anxiety. There's no mental health. You've spoken to the doctor, there's nothing wrong, nothing urgent, so it gives you an assurance that everything is fine. So for healthcare professionals, important thing is, increased number of patients can be coming, then a lot of satisfaction of delivering the better patient care, and you can give less costly treatment, more affordable treatment, and then decrease possibilities of no shows of appointment. People generally take up the appointments on the things, and good relationship with the patient, because you can talk to them as much as possible. For the patients, their travel is saved, their cost is less, they don't have to wait for the treatment. The moment the patient is the doctor is on, you can talk to them. The cost is definitely less. Specialized treatment is also possible, and all the bedridden patients, sick patients, they don't have to move from home to the hospital, and they can have treatment at home itself. So that's a very reassuring. But whenever you're doing the teleconsultation, most important thing is, don't start thinking or chatting like your friend. Be prepared well. Take down all the summary, whatever has happened, and then what are your problems, what are the questions you have asked. Send them to the secretary of the doctor beforehand, so that आप पढ़ लीजिएगा, पढ़ेंगे तो अच्छी तरह से समझ में आएगा. So we've been doing this. What I do is, I get all the documents ready completely to my secretary. She makes the entire thing ready, and then I go through it carefully for about 5-10 minutes before the consultation. So when Mr. Rathore or Mr. ABC is on, I tell them, Rathore sahab, aapka diabetes kaisa hai? Now he will be happy that I know that he's got diabetes. He will be happy to know that he's got his stents, and I'm aware of it, and I know his problems. आपका सिर में ज़्यादा दुख रहा है, मैंने सुना है कि आपका 2 साल पहले ऑपरेशन हुआ था ये. So when I have read everything, his confidence level is higher. So that is the importance of giving the documents. If you think that you will just flash the document on the telephone to the patient, the doctor, and then think that he will read and understand immediately, that's wrong. So, and then keep the summary ready to read out, and all your questions, keep the questions ready, and then write them down. Don't send one report and then say, Doctor Sahab, मैं कैसा हूँ, आप कैसे हैं, आप बताएंगे, रिपोर्ट बताएगा शुगर कैसा है या कुछ जो भी है, and then after that, understand all the questions, follow up the questions, have a fruitful discussion rather than wasting time, and then fix the next session. Next कब बात करना है, एक महीने के बाद, एक हफ्ते के बाद, आगे क्या करना है, and don't waste time. Make the best out of it so that he is happy, you are happy. These are the advices that I have. And then, so I'm ready with the thing. I just want to show two patients examples here. 55-year-old lady, just there are many like this. This is just one example. 55-year-old lady, she had a breast lump last year, and then she had a biopsy, and then that was cancerous. While she was thinking what was to be done, she consulted many oncologists, and she was having the requirement of chemotherapy first, and then later on the radiation and surgery and so on. Her sequence was fixed. And suddenly she started having fever soon after all this. And then she turned out to be COVID positive. This was last year, the first pandemic. And then we waited for her infection to subside. Now she had cancer, she had COVID, she had positive, and then she became all right. Everything was treated at home. She was panicking, she was afraid, she was scared, but then we reassured her every time on the phone, on the video consultation, and then she waited for the infection to subside. Later on, she had successfully completed the entire chemotherapy. She had completed the entire surgery, radiotherapy. Even in the lockdown period, she used to have radiotherapy, and then she is now on maintenance therapy. She is doing fine, and then she's had the vaccinations. She is doing fine. So hope that she does well in future. But this is what can happen. So the important thing is, she has fought the COVID, she's fought the cancer, and she is fine. Now, another example is a 65-year-old gentleman who already had some other problems of whole heart problem, diabetes, and so on. And he had lung cancer recently detected, stage 4, and he had 3 cycles of chemotherapy, very good response. And after the 4th cycle, he had the COVID infection. He was treated, recovered well, and retreatment started. So that's how the process. So therefore, the conclusions are that it is possible to combat the cancer. It is possible to take care of the COVID. You can even if you have the COVID infection, you can manage it. So that's all the things. And please vaccinate yourself, prevent the corona. Don't misunderstand, don't underestimate the cancer, don't ignore the cancer. Be safe. And then my greetings to you all, and I'm ready to take all the questions.
Thank you, sir. Thank you. That was very informative. I think we covered quite a good number of topics. I have one question from Mr. Manu here. Any patient who's in the initial stages of lung cancer, but it's undiagnosed yet, and if they get affected by COVID and suffer heavy breathing problems, will it trigger cancer conditions?
It won't trigger. The COVID infection is not going to trigger any cancer, if that is the question. The COVID infection will complicate the cancer treatment. Definitely, it may delay the cancer treatment. And supposing if the lungs are damaged, then we have to change the treatment according to his thing. We have to see that the lung infection is not happening again and again. So we'll have to be careful about in treating such patient if the lungs are already damaged by COVID.
Okay. So prolonged use of mask for about 7 to 8 hours a day would lead to carbon dioxide toxicity in most people. How do you tackle with this?
Okay, so I don't have statistics to say that, but medical professionals have been using the mask and the PPE and the helmets and whatnot, and then they have been keeping fine, and they have not had any carbon dioxide retention. Yes, there would be some problems of headache because the tight masks and so on, and then in between you can go to a safer place, remove the mask, breathe yourself, and come back and then use it. And at home you must wear some mask which is not very uncomfortable to wear. Double masking, you can use one loop and stitch the mask, and you can actually invent your own methods. What I normally do is I have stitched 2 masks together, and then I use only one thing in the ear, not 2 things in the ear. You can have some headbands to change it. You can have multiple things. There many things are available. Instead of putting in the ear things there, you can put it in this somewhere in the head so that it remains tight. So you can keep changing and things, and especially those who are wearing specs and masks, it's a problem. So you invent your own way of keeping it safe and comfortable, and don't worry about the carbon dioxide. If that is a problem, those who have a suffocation feeling, they can go to a safer place, remove the masks, and breathe sometimes and come back and do it. So it's something like that. When they're alone in the room, they don't have to wear a mask.
Yes.
That's important. That's a time when you can be mask free. But supposing somebody is there, wear your mask. Because there is no point wearing a mask inside when you're alone in the room. And especially nobody has entered the room. So for example, if you're sleeping alone in the room and somebody is entering, wear your mask. The moment the person leaves, and then after that, wash your hands if you have touched him, and then sanitize yourself, sanitize your things, and then remove your mask at a safer time, which is about 10 minutes after the person has left. You can remove your mask and be free. That's a way. And then use your own common sense, your logic, and your hygienic sense, everything, and then use them right.
Are there any guidelines for vaccination of cancer patients? And which
Yes.
is better, vector-based vaccine or inactivated virus-based vaccine?
Important thing, all experts say, take the vaccine, whatever is available, whenever is available. That's it. And except the transplantation, all other patients, in case supposing let's say the patient may say my chemotherapy is getting over tomorrow, and then can I take it after, and the vaccine is not available or schedule is not available, what do? You just take it. What will happen? There may be little less efficacy acceptable than zero efficacy. So therefore, and then a time will come when booster dose will be available for them.
Yes.
Right.
A patient with tracheostomy, what additional precautions should one take?
Yeah, so good question and a very good practical question. They have to see that the tracheostomy is not infected, and then the tracheostomy is clean, and then it is repeatedly this thing. The inside pipe is there; it is very clean, and the whole thing should be kept clean. And that's it. That's all. And then take the precautions. If there are too much of bad secretions, have good fluids, remove them. See that it doesn't get blocked, and then you are actually better off with the tracheostomy than not, because even if one has a lung infection, it's easier to manage in the tracheostomy patient than normal patients. So the tracheostomy patient should not feel that, okay, they're handicapped. They're not. They're probably better enabled.
When a person is suffering from lung cancer and at the same point gets infected with COVID and has difficulty breathing, how do you try to manage both?
Just oxygen, and then we have had many patients who've had this problem. So oxygen supplements as and when required, at home and in the hospital, wherever. And then they have to be under very good monitoring, because both of them can be dangerous to his life. And let me tell you that a lot of patients of lung cancer had COVID infections, had lung infections, and they've recovered. While the cancer was getting better, the COVID infection got them, and then they became better from the COVID infection. They're getting better, and then yes, it does make them weak for some time, but they recover and fight both.
Okay. I think that's all the questions we have for now. Um, do we have any closing statements?
Yeah, fine. So it is possible to combat the cancer and the COVID, prevent COVID, and in case one has the COVID, treat the COVID infection, drive it away from us and from the family, from the society, from the nation, and then vaccinate yourself completely. And then think that by protecting yourself, you're not only protecting yourself but also your family members, your immediate society members, and everyone else. You're contributing through your family's health and also to the society's health and the nation's health. So in case you get COVID infection, you're giving it to many others. So that's important message we want to give. Second thing is, if there is cancer, don't think that the cancer can wait. Don't keep it pending. Just discuss and then get going for the cancer treatment, because cancer is not going to spare you. COVID may spare you, but cancer is not going to spare you in case it spreads. So therefore, combat both cancer and COVID, and it is easily possible to do that. Stay safe and wish you all the best. Thank you very much for this opportunity, and thank you for patient listening. And I hope this has been of some use to the people.
Absolutely, sir. You try to cover all the topics that are necessary, especially for the general audience, because this is something that we read so many websites about all this, and it's very confusing.
Right.
All these questions being answered from a professional like you really solves a lot of doubts for our audience.
Right.
Thank you so much for your time. Thank you for this.
Yeah.
And I thank Phobase Care, the team, and Kshitij and Hitesh for this opportunity to moderate this session. And I hope everyone is safe. Everybody spends as much time with their families as possible.
Yeah. Thank you. Right.
Thank you so much.
Thank you so much, sir.